one of the co-owners here at Family Source Consultants, and this is Zara, the other owner as well. We are in Illinois. We have 2 locations in Illinois, and we are a full-service surrogacy egg donation agency. So basically, we facilitate from start to end. And just to get started a little bit, I don't know how much, if you've been here all day, or how much you know about our facility. Do you have any questions that you can think of? I know it's such a short time, so I'm trying to get as much in the
Usually
quick
people
20
want to know
minutes.
about the cost and the time frame, I would say. To match with a surrogate, probably the average time is around 6 months. It could be more or less, depending on what your criteria is, if you have certain state requirements or, certain requirements based on, age or whatever it is. And basically we will match you with somebody who is the best fit for you, but it might take longer or it might take less time. It just kind of depends. And the cost for surrogacy and egg donation at our agency is averaging around $80,000 to $90,000, all said and done, as long as everything works out according to plan for the most part, and there aren't any huge major setbacks. Let's see what else.
Our agency has been here for it'll be 8 years in January. And we do approximately around 60 to 70 surrogacy matches a year. So we're a fairly medium to large agency. So we're located in Illinois, where there is an actual law there in Illinois. It was actually drafted in 2005, the Gestational Surrogacy Act. So basically what that means is then intended parents may go directly onto the child's birth certificate without any court proceedings, as long as there is at least 50% of genetics used. So if intended parents are using say your sperm and you're using an egg donor, then you fall under that law. So basically, we've had a few cases where intended parents may be using a surrogate, a sperm donor, and an egg donor. Well, therefore, it doesn't fall under that law. So we would match them in a state where they could utilize the laws, maybe Ohio, wherever that may be. So those are very small numbers, but basically Illinois is one of the best states for surrogacy as far as the law goes.
Which IVF clinic do you guys use?
I'm sorry?
Which IVF clinic do you use?
We, in Chicago, we work with all of them, basically. We work with a few more than others.
Right.
Fertility Centers of Illinois, we work with quite a bit. Dr. Kaplan at FCI. We work with Dr. Trukacheva at RMI. So those are the 2 most common, but we work with, there's Dr. Morris, there's Dr. Miller. So there are other fertility centers, but FCI and RMI are definitely the most common that we use.
And we do work with IVF centers in other states besides Illinois too.
Right. Absolutely. So.
And our surrogates tend to be primarily, I would say, in the Midwest. Is it the highest percentage are concentrated in the Midwest, but we work with surrogates all across the United States and intended parents around the world.
So as long as obviously the laws in the state where the surrogate lives, maybe Florida or Georgia, where they are also surrogacy families. So, our goal is we would love to have as many as possible from Illinois, just because the law is there. A lot of, most intended parents do request a surrogate in Illinois. Sometimes they're open, it just depends on their location. We work with quite a few international clients, so therefore they feel, I think, a little more comfortable with everything being wrapped up in Chicago. But there's also a lot of intended parents that if we match with surrogates who maybe live in Florida, Iowa, or and it works out fine as well.
How about your egg donors? Are they also mostly from the Midwest? The egg donors?
Most of them are, but again, we have quite a few also that come from all over as well. And obviously, as long as they're in the United States, it doesn't matter what state they're from. So, but yeah, most of them I would say are in the Midwest. And I think probably just because we're located there, so they're looking for someplace to an agency to work closely. But sometimes that doesn't even matter because the intended parents, they could be working with a Connecticut fertility, and the donor would still, when she lives in Illinois, would still have to travel out there for the medical and the retrieval. So And then also depending on, and this goes for the surrogate as well, they can also have monitoring done locally near them. So they don't have to go to the fertility center that you're working with for every single appointment. So we really try to assist on that end as well to make it as convenient as possible for the surrogate, the donor. So we believe that the most important thing obviously is finding the candidate that you feel most comfortable with, really. And basically, intended parents, what they do, you would have paperwork that you complete. You would let us know what your criteria is within a surrogate. And like Dara was saying, we would then share profiles of the surrogate that meets the criteria that you're looking for with you. And we match first come, first serve. However, some intended parents are bypassed just because of the criteria they're looking for in a surrogate. So, say we have an Illinois surrogate that comes on board, great candidate, she's ready for her profile to be presented. Well, maybe the first person that's been waiting the longest, they may be international, where the surrogate may not want to work with an international couple. So we'd have to pass them up, obviously, go to the next 10 parents. So it's just as important for the surrogate to feel very connected as well. We want everybody to sit as 10 parents.
Agreement on the important issues like termination and reduction. Everybody has to be on the same page with that. And of course, vision for the relationship. If one person wants more of like a business relationship, but the other one's hoping to grow a friendship, it might, so personality and stuff kind of comes into play too.
It's a long journey. It's an important journey. We want everybody to be fulfilled, and have the best journey that you can. So, and we believe that we make very good matches. I mean, it seems like we have most of our matches. Everybody has a wonderful and fulfilling experience. So that's what's most important. I mean, we want everybody to, make the best out of it.
No matter what, I are parents through our previous intended parents. I have boy-girl twins who are 10 years old, born through surrogacy and egg donation, and Stacy has a son who was born through surrogacy and has been an egg donor twice for the same family. So I think probably what sets us apart from some agencies is the fact that we've gone through it ourselves.
We definitely have a personal touch.
Yeah. And so
compassion, obviously you understand. Been in your shoes. So yeah, it's pretty much.
We hold our escrow. We have escrow services too that are included with our agency fees. So we handle all of the financials. So all of your surrogates compensation and stuff will come out of your escrow account with us.
Does anybody have any questions for us?
Probably everything, all like this melting together and all like that.
It's probably the same. You're probably hearing the same stuff over and over and over.
So my partner is from St. Louis. We're just trying to think if that makes sense for us to do this whole thing in the past. Can you think of any advantage or disadvantage, surrounding this thinking?
As far as doing it in the Midwest?
Right.
I guess you'd say closer to St. Louis.
Because we can go.
Do you live there now?
No.
Family. My entire family.
Oh, your family.
Oh.
I mean, the advantage, if you were to say, I would love to work with someone in Missouri if we found the right candidate. That would be our first choice. But we'd still like to see candidates maybe that are, other good candidates. But if you made that your first preference, then we would certainly do our best to match you with somebody in Missouri, let's say. And the advantage would be if you're going to be visiting your family, then you can kind of kill two birds with one stone,
So just make it more convenient for
It
you
just
to
make it
visit
more
doctor appointments
Right.
or your surrogate or whatever.
And then after the baby's born, just for the long-term relationship, then when you go to visit your family, you might work in a get together, if your relationship continues that way. So yeah.
What about the laws of Missouri in general? It certainly doesn't come up.
They're really vague. There really isn't any.
Yeah.
It's just kind of like, we've had surrogates deliver in Missouri before, and there hasn't been an issue.
Yeah, you can still, your attorney would go to court before the baby's born. I don't know if the intended parents have to go before the baby's born to court. I don't know if they have to go at all.
Right.
But you will get your names on the birth certificate.
Sometimes it depends on the county too. So
Right.
that's the only difference.
It's just a different process, but it still will happen.
So there is still court proceedings done, but you will go home with your names on the birth certificate.
And with any match or any intended parents that we match with a surrogate in whatever various state, we would always have you speak with an attorney in that state just to make sure you were comfortable. Because we know, I think, quite a bit about the various laws in different states, but we would rather have you get it straight from the horse's mouth just to make sure we don't
Right.
give you wrong information.
And their exact procedure, right?
And then if you're comfortable and you end up ultimately matching with somebody in that state, then you would probably work with that attorney and have already established your connection.
And sometimes it's always changing. I mean, if there's like no law for it, they just we may not know. It just has never been publicized. Just different steps that the attorney makes. Maybe they don't have to do this anymore and they can just bypass this sort of stuff. So it's forever always changing, especially if there's no law. Like right now, Illinois has the law, so it is what it is, and there's no way around it. It's great. The attorney has filed a court order when your surrogate's typically right before her 6th month, and a file goes down with the state, a file goes in the hospital, and that's it. When the baby's born, your name's go directly in the birth certificate. So it's very, very simple, which is why it's a very obviously demanding state, which it is so easy. I mean, you wouldn't want the ease of it,
What are those insurance plans in Illinois? Typically, if someone does have insurance, do you generally see them covered?
Sure, as long as there's not a surrogacy exclusion.
Right, but I mean, in general, do you tend
Are
to see that
there?
in...
We're seeing more and more surrogacy exclusions, but with the healthcare reform, it looks like
It's in favor of surrogacy.
So basically, even if a surrogate currently had insurance and had an exclusion, we could put her onto a different plan, basically like an individual Blue Cross plan. So you would be paying for it, whatever the monthly cost would be, which probably now I think it's probably gone up, but figure like say around $400 a month. And
again, that's just unknown because nobody knows how it's until January when it starts. And actually, it's supposed to go down because that's what it is, the Affordable Health Care Act. So we'll see how it all balances out.
Right. I mean, it's always our goal to find surrogates who have insurance that they can use, either through their employer if they're employed or their husband's employer. But that's always the preference. But unfortunately, more and more policies started adding exclusions.
But again, that like she was saying, it's just going to change now.
But now it's changing for the better.
Now all surrogates everybody's going to have maternity, regardless if you need it or not. And it's just looking for which policies or states are going to have exclusions. So far, it looks like Illinois is not, and Ohio is not. So certain states are starting to finally leak it out. So that's good.
Yeah.
So it's just going to be a win-win.
But either way, we will be discussing the insurance. You'll know exactly what the situation is. If it doesn't seem for whatever reason, we can find a solution for this, the surrogate that is affordable or that you're comfortable with, then, maybe she just won't work out.
And we have a Tracy who works for us. She's our insurance consultant. So she's constantly looking at all the new information that's coming out, trying to dig up information. And again, right now, it's just starting to come out. October 1st, they started sharing some information. So, but all this is going to go into play in January, so we'll see. But it looks like it's going to be for the better. So it's a good thing, for sure.
So are you all just basically starting the process now, or?
I'm actually an attorney from Texas.
Oh, are you?
Yeah.
Okay.
Oh, where are you from?
Texas.
Oh,
Okay.
Yeah.
Texas has good laws too for surrogacy.
Do you work with Simple?
We work with Simple Law. We work with conceivability. We work with different agencies. We like to be kind of the liaison through Texas.
We worked with Little Flower, with Baby Cole.
Oh, yes. Yes, I work with Dave a lot actually. We see him all the time. I'm with Florida.
Any questions, just feel free to shoot us an email.